All right. Welcome to the second episode of the BioBelly Show. Today we have a super special guest. It is Dr. Anam Khan. Dr. Anam Khan is a board certified gastroenterologist with over 15 years of experience. Currently practicing in Houston, Texas, she's affiliated with renowned MD Anderson Cancer Center, where she's actively involved in clinical research and patient care. She specializes in complex gut health issues, including non infectious gastroenteritis, colitis, and chronic constipation. And she has co authored multiple peer reviewed studies on eosinophilic colitis, exocrine, pancreatic dysfunction, triglyceridemia induced pancreatitis, and the impact of statins in cancer research. Dr. Khan earned her medical degree from Aga Khan University, where she was recognized with Dean's Honor in Psychiatry. And in 2021, to top it off, she was named one of Houston's top gastroenterologists. So, Dr. Anam Khan, thank you so much for being here today.
Thanks, Trishri. Thank you for that really warm introduction. Thank you. That was very humbling and very kind of you.
Absolutely. It took me a second there to pronounce the names, the triglyceridemia, hypertriglyceridemia, but I hope I gave it justice.
Yeah, it's a mouthful. So we can
It,
just call it gut health.
Gut health, done. Gut health. So, Dr. Khan, could you take us back to the beginning? What first inspired you to pursue a career in gastroenterology? Was there a personal story or a moment that shaped your path?
Yeah, I feel like life never, it's not intentional and things just happen. And you look back and say, this is where I was meant to be. So I was in med school when I was very fascinated by cardiology, oncology, cancer medicine, as well as gastroenterology. And here, many decades later, I'm working in a cancer center, I'm practicing as a gastroenterologist, and I'm married a cardiologist. So, life worked out in a funny, poetic way. But, the reason I enjoy what I do so much is because GI is actually a constellation of over 200 diseases. So there's never a dull day. I have to keep reading. I keep meeting patients with different conditions, which keeps it exciting. There's a lot of new innovation that's coming in my specialty. And it's a specialty that involves a combination of thinking as well as skill because it's hands on. So when I do procedures, I sort of meet my enemy. I enter the body, I see pathology, I biopsy. So it's a really exciting combination of skill, storytelling, and science.
Right, right. And for people who may not know, what exactly, you did mention the biopsy, but what exactly does a gastroenterologist do? In that, what are situations where someone might think about consulting one?
Okay, so I work at a cancer center, and one of the roles that I've taken on is screening. So GI, everybody will meet a gastroenterologist because of screening. So, the American Gastroenterology Association has recommended that all individuals age 45 and older get screened for colon cancer. And colon cancer screening can happen with a colonoscopy, which is what I do, but also with stool-based tests. But if those stool-based tests are positive, then those patients will come and meet a gastroenterologist. So your question, I think, was when do we meet a gastroenterologist? So in terms of, just cancer prevention, when that time comes, it's important to make sure that every individual has been screened in some form or fashion. And if that involves a colonoscopy, then patients will come to me. So that's the screening part of it. But then there is the diagnostic part. So, the GI tract involves all organs from the mouth all the way to our anus and our rectum. So any condition that affects those organs, if there are any symptoms that can be traced back to a dysfunction in those organs, that's when folks will seek out care from a gastroenterologist and meet somebody like me.
Sounds good. Sounds good. And talking about some of those conditions, you mentioned you work in a cancer center. I do imagine, though, there are people with severe IBD who also come through the door and
Yeah.
ask for help. If we could talk about some of those conditions a bit deeper. What exactly happens in the body that leads to diseases like colon cancer and IBD, like common factors?
Okay, so for colon cancer, there are hereditary and non-hereditary forms of colon cancer. So the colon cancer that runs in families, those patients have a family history of colon cancer in multiple family members, and they then embark on this colon cancer screening journey much earlier than the age 45, which I had recommended for the general population. So those patients, to answer your question about what predisposes them, genetics is a big part of that. But for the average risk individuals who, that's the great majority of Americans, there are certain factors that have been implicated in the pathogenesis, meaning in the dysfunction that occurs at a cellular level that leads to cancer formation. And common things that have been implicated are consumption of red meat, processed meat, alcohol, obesity, physical inactivity, lack of fiber. So these are some diet and lifestyle factors that have been implicated in colon cancer occurrence. But the most important one is that only two-thirds of Americans are screened for colon cancer. So the vast majority of colon cancer that occurs are in individuals who are either completely unscreened or they're behind on screening. So what I tell my patients is when they wake up from a procedure and I tell them that they have something like called polyps, which are precancerous growths, and they ask me, well, what can we do to decrease our risk of developing colon cancer? The most important thing you can do is come back for timely procedures and be plugged into a system where you can keep getting screened regularly. So that's, in regards to colon cancer. Your other question was about inflammatory bowel disease. So inflammatory bowel disease is again an immune dysregulation that occurs in the colon the majority of the time. It can occur in other parts of the GI tract when there is dysfunction. And so patients have chronic symptoms like diarrhea, blood in the stools, weight loss, nutritional deficiencies. And it's two diseases, Crohn's disease and ulcerative colitis, that are managed now in a very sophisticated way. There have been a lot of changes in management. But yeah, this disease is also on the rise in the GI world.
What is the difference between Crohn's and ulcerative colitis?
They both come under the umbrella of inflammatory bowel disease. They are managed a little bit differently. They occur in different parts of the GI tract. So Crohn's disease can occur anywhere in the GI tract, while ulcerative colitis occurs exclusively in the colon. They present similarly. They're both diagnosed with a colonoscopy, and yeah, I can go on and on, but they're diseases that definitely need to be managed by a gastroenterologist.
Got you. I do remember I was looking at one of your posts and there was a image of, I believe, the intestine of someone with severe ulcerative colitis. I might be wrong here, but you said something about how a cal protein test will be conducted post diagnosis. What is that? And was
So
that another part of the colonoscopy?
yeah, so that's very interesting that you bring that up. And I often wonder, who is my audience? Because I work in an academic institution where I have very complex patients. And sometimes on my social media channel, I'm unsure and I'm thinking about this, that is this directed at the general audience, or is it directed to medical trainees where they have that background knowledge to appreciate what those posts are about? But this one particularly was a patient with Crohn's disease. And what's really neat about the body is that Crohn's disease and ulcerative colitis are manifestations in the GI tract of immune dysregulation. But in that constellation of immune dysregulation, these patients can have skin manifestations, they can have eye manifestations, joint manifestations that all come from an underlying autoimmunity, which means your own body's immune system is attacking itself. And so that particular picture was of a patient who had a very severe skin finding that was occurring in association with his colitis. And what's really neat, and the point of that post was that sometimes these skin conditions mirror the disease activity of the colon process, and sometimes they behave independently. They follow their own disease trajectories. And in that patient, his skin findings were his more problematic issue as opposed to his colon findings. But it was really neat how I was trying to discern whether this flare up of his skin condition was happening because of a flare up of his underlying Crohn's disease. Was it a separate skin entity? So that's where I have to put on my diagnostician's hat, which goes back to, why I chose GI, because it really keeps us thinking, playing detective. And these are real patients with real issues that impact their quality of life.
Understood. So that was an image of the skin. It wasn't an
That was
image of.
no. It
Okay,
was an it
yeah.
was an image. It was quite severe. It was occurring on his, arms. His skin was peeling. It was painful, and that particular condition, I believe, was a condition called erythema nodosum, which occurs in conjunction with Crohn's disease.
Wow. Okay. So, in a limited perspective, I do see that there's kind of two ways to it. One is like the IBS, where it is a
Yes.
functional disorder. However,
Yes.
heard that if someone were to take a magnifying glass and to look into the insides of the body, you might not find much. Like, but there is like obviously like hypersensitivity. There are issues going on, but you can't see it. Whereas the ulcerative colitis and the Crohn's
Yes.
disease here you can actually see like issues going on.
Pathology.
Pathology.
Absolutely. Yeah, you've nailed it. So, irritable bowel syndrome is a diagnosis of exclusion, which means that if a patient is suffering from bloating, from pain, they should see a GI, undergo a pretty comprehensive evaluation to rule out mimickers like inflammatory bowel disease, which definitely has a structural manifestation, a histological, meaning on the biopsies, you can have classic findings. So, those things need to be excluded before making a diagnosis of irritable bowel.
Understood. And so irritable bowel disease and IBD, I did understand when you said earlier that obesity, not getting proper screening, probably a negligence of a proper diet, those are main factors in leading to these diseases. But if we could put a magnifying lens on exactly what's happening in our body, what is it? Like I know there's this gut lining, and I know like there's an esophagus, stomach, small intestine, large intestine, and then from there, of course, the rectum. From in this process, what is exactly going wrong? Is it the gut lining? Is it a dysfunctioning of some of the organs like pancreas and liver? If you could take us step by step, what is it like in the body that's going wrong, which is leading to like this cascade effect into culminating into like a major disease?
Are you referring to irritable bowel?
Yes, irritable
Okay,
bowel. Mhm.
irritable bowel. Perfect. So great question. So what happens in our GI lining is that there's a tight barrier. It's a single cell layer called the epithelium, but it definitely acts as a barrier. If you imagine how much food we're consuming on a daily basis and how much there is a possibility of exposing our cells to all kinds of toxins, but the agent that protects our body is that epithelial cell layer. And moving on even further microscopically, there's something called tight junctions, which is like the cement that holds these cells together and promotes that barrier function. So, what happens is that when there is a breakdown of this cement, then it allows the barrier or the intestinal lining to be permeable and allows toxins to invade into the lining, which then makes our immune system exposed to toxins, and it leads to inflammation, immune dysregulation, and then downstream there can be all kinds of diseases that occur. What's really interesting is that, in recent times, we've learned about the gut microbiome, which is, a composite of trillions of microorganisms that reside in our colon. And it is these microorganisms that are keeping those tight junctions, which I mentioned, intact. And so, what's happening in irritable bowel is that as a result of consumption of ultra processed foods, of overuse of antibiotics, the energy that was being synthesized or made by these microbes is now dysregulated, and as a result of that, those tight junctions, which were nutritionally sustained by the microbiome, are breaking down, and this is leading to inflammation and immune dysregulation. In addition to that, what we've learned is that there's a close association between the gut and the brain. And, this has been proven in animal studies and human studies as well, that the microbiome directly affects how we perceive different symptoms in the GI tract. And so what's happening now with chronic stress, altered sleep habits, which is disrupting circadian rhythms, that there is an IBS epidemic. But what's also neat is that there is now this awareness where we recognize that there is this very real alive gut microbiome, which in with the right substrate, meaning the right food, the right lifestyle habits, can be altered to support our gut health.
Yeah, I'm just trying to sink that in.
No, I know it's
Yeah,
a lot of information,
yeah.
but
Mhm.
ultra processed foods are really the enemy here, which is why I feel that a lot of functional disorders, which is what we call irritable bowel syndrome, it comes under the bucket of functional disorders, and there are other functional disorders in the stomach and the pancreas, etc. But uh, this is one of the reasons why this may be on the rise.
Understood. And going a bit deeper on like the power of the gut microbiome, I have heard there is a connection from the gut microbiome to the brain. You were referring to that by saying that high stress leads to the worsening of these symptoms. What exactly is the link between the brain and gut?
What exactly? So, I mean, there's a very close link. There have been animal studies in rats where the vagus nerve that supplies the intestines was severed. And in those patients, many of the symptoms that are a hallmark of irritable bowel were not being perceived. And so the signals that go from the small bowel, which is where digestion and absorption occur, from the colon, where motility is occurring, how those signals are being perceived in our mind, and how we are interpreting the process of eating. It's a very sophisticated system. We have neural pathways, we have hormones that are released by different parts of the GI tract, um, but in essence, knowing that there is a close link and practicing mindful eating is so important because it's bidirectional. So, even it's not just what we're eating, but also how we're perceiving eating, because we can send neural signals back to our enteric tract to calm it down, which is why for many of our irritable bowel patients, we send them for behavioral therapy so that they change their relationship with eating, and oftentimes that leads to good outcomes.
Makes sense. Do you sometimes also refer patients to gut-directed hypnotherapy?
Yes, yes. So at the previous where I trained, we had a really neat hypnotherapy center, and it was great. But I think now for many, individuals who don't have that kind of access, it's not difficult to look up and see what the principles of therapy that's being delivered are, and see if in day-to-day life, we can practice mindful eating, which and control our symptoms. There's this whole thing I talk about with my fellows about intuitive eating, which is, steering away from fad diets, which have a tendency of making patients rebound very badly. So if the intent was weight loss, oftentimes that's just not achieved by going on fad diets. Intuitive eating, on the other hand, is where we respect our body, we respect our hunger cues, and we eat in a mindful fashion, and we do submit to pleasure eating in balance, uh, because of recognizing that the gut and the brain are closely linked, and many of the symptoms that we are perceiving can be altered if we have that understanding of how it works. So, while gut-based hypnotherapy done in the hands of a therapist, I'm not discounting how useful and meaningful that is. But I think, in the wider population as well, just having an understanding that, we can adopt some of those principles in our day-to-day life as well.
Makes perfect sense. Um, I wanted to ask you the role of supplements. I believe treatment, of course, along with the long-term solutions, which is, of course, just as you said, eating real foods, practicing mindful eating, having a good relationship with food, exercising, low
Yeah.
stress, sleeping well. Those are the kind of the meat and potatoes, proverbially. But the sometimes what we have tendency to do, and this might be a credit to just the marketing strategies of supplement brands. They kind of sometimes the narrative is we need a certain supplement or we need a certain tincture, and that will supposedly heal all our problems. Now, in terms of medication that we are ingesting, I believe there's two. One is a bit of like maybe the harsher medications where we see maybe like the antibiotics and the steroids, and then there's maybe on the other end of the spectrum, you see this rise of nutraceuticals and supplements like natural herbs, bacterial strains, probiotics, prebiotics. Nowadays, we're seeing like prebiotics, probiotics, and postbiotics all in one.
Yeah.
Um, so I was wondering when a patient does come to you for something like IBS, what is the usual thinking process? Uh, Based on, I know it's a patient to patient basis, but what are you gauging to see if they're more suited for the probiotics or the harsher medication or a mix of both?
Glad that you touched upon this. So probiotics are essentially, the good bacteria, which we can reconstitute in our colons just by eating a well balanced diet. So I'm in the camp of eat the rainbow. You can do this on your own. If we become so dependent on a supplement, which may be great and providing you with certain good bacteria. There are micronutrient supplements with zinc, with turmeric. All of that is great. But an over reliance on supplements could end up making our main diet, the basis of our diet, perceivably unhealthy, right? Because we're countering it with ingestion of supplements. So in my practice, my advice to my patients is to eat a variety of plants. There was a big study that was done in the UK and the US where they studied the beneficial effects of eating 30 plants in a week. And what was seen was that had great results on gut microbiome diversity, health, and 30 is an arbitrary number, but by having a variety of plant-based foods, we can do the same thing in our colon that a supplement is doing, albeit the supplement's doing it in a limited fashion, and our diet can actually do a better job of it. And just trying to keep it as staying away from ultra processed food, which is a known enemy. So, eating plant based foods, fruits, legumes, beans, seeds, these are all good things, fiber, right? Which will promote microbial diversity and allow our microbiome to produce probiotics naturally, which will produce the fatty acids that sustain those tight junctions, that will prevent toxins from entering and leading to inflammation and immune dysregulation. Um, and if your primary care doctor or your gastroenterologist has discovered a micronutrient deficiency for which they are recommending that you take a supplement, it's important to take a step back and see why you have this micronutrient deficiency to begin with. There's a whole myriad of real GI problems like pancreatic insufficiency, celiac disease, small bowel intestinal overgrowth, where there is a very real reason for why patients have a deficiency. So rather than putting a band-aid on it by taking a supplement, it's important to get to the root cause, treat that disease, and then get back on track by having this amazing plant-based diet. So
Because I totally resonate with you, Dr. Khan. I believe the reason why there is even a small consideration of relying on these supplements is simply because it's just more convenient. But again, I do feel like just having the foods itself, they make it so that they're also more bioavailable, and it's a more natural process versus just, taking a supplement. Earlier, I wanted to just backtrack just a
yes,
bit. When we said the probiotics, prebiotics, and postbiotics, you did say the probiotics are the good bacteria, right? The good living bacteria.
yes.
Yes, but then the prebiotics are the food for the bacteria.
Yeah, so good examples of prebiotic food would be like sauerkraut, kimchi, kefir. These are things that when you take them, they allow fermentation in the intestine. They're food for the bacteria, which are the probiotics.
Understood. And then what would be the difference between these prebiotics and fiber?
So fiber, so that's a good question. So fiber is fuel for the microbiome. We as humans do not have the enzymes from a ecological, from an evolutionary standpoint to digest fiber. But our microbiome, the bacteria and the fungi, they do have the enzymes, and so it's food for the microbiome.
Understood.
And then when they use that as food, what they end up doing is they produce fatty acids, and the fatty acids are fuel for those tight junctions, which are so important for us. So it's a symbiotic relationship, but fiber is great. Fiber should be consumed in abundance.
Understood. And then what is the final one? Postbiotics.
Right. So postbiotics would be the fatty acids, which I mentioned, right? So
Okay,
when,
right, sorry.
yeah, that's what they're producing.
Understood. The single chain fatty acids that are, as you said, the tight junctions. Makes perfect
Yes.
sense. I wanted to ask, in the shoes of someone in like a severe IBS situation, sometimes because I'm trying to go back to the supplement discussion,
Yes.
sometimes what we see is because there is so much pain, like for example, one great source, by the way, of just understanding stories, of hearing stories of people with IBS and IBD is actually reading Reddit. Because these people are anonymous. They're just anonymous names, so they can be super transparent with exactly what's going on. And what they say is, like for example, one of them had IBS-C, so the constipation, and she was talking about how like people told her to go on the low FODMAP diet and just drink a lot of water and eat healthy, but for
Right.
some reason that wasn't cutting it. And
Sure.
then people, I feel, they resort to like the laxatives and like the Miralax and other like just supplements in general. Is there a way to like maybe produce supplements in a way that they can be it could be a symbiotic relationship with food?
Oh, absolutely, absolutely. I mean, when I say supplements, I mean, probiotics, fiber, zinc supplements, things like that. There's definitely a role in very specific conditions. For my patients with irritable bowel and constipation, many of these patients are elderly. They are not independent in terms of cooking or grocery shopping. And so for them to rely on being able to calculate the fiber content of everything that they're consuming in a time period like a day is very difficult. And so for them, I am a huge proponent for taking a fiber supplement. And fiber is really neat. You can get it in all shapes and forms, ranging from gummies to wafers to powder. The goal is to get the fiber, and we have to make it pragmatic. And so I am definitely a proponent for supplementing when you are unable to institute it in a convenient manner. Even for probiotics, I mean, there is definitely a role in post-infectious irritable bowel syndrome, antibiotic associated diarrhea. Just my earlier message was on an over reliance on supplements to
Right.
supplement what food should be doing, right?
Absolutely. And what I do see sometimes is people talking about how the form of the supplement itself can could basically determine the efficiency of the probiotic, in that sometimes live bacteria doesn't survive in certain supplements, like you said, the wafers, the gummies. Is that something that we should be thinking about? Like nowadays when you even see supplements, they say they have a delayed capsule so they can
Hmm.
survive all the way to the
Hmm.
colon.
That's
D
right.
So is there some narrative on some supplements not being effective because the active ingredients that they claim to have in them, they might not even be alive or able to make an effect in the gut microbiome?
Um, So many things are enteric coated so that they're released in the intestines and they survive stomach acid. So if the goal is to release things, where you want them to act, then of course I think having an enteric coated supplement is needed. But I can't speak too much to this industry or gauging what is effective or not, because as you know as well, there isn't a lot of regulation when it comes to the supplement industry, unlike pharmaceuticals. So yeah, that's where I'd leave that.
That makes sense. Yeah, because I feel like that's maybe one of the things that, just as you said, because it's not very regulated, and maybe because nowadays brands who are trying to come out with a solution for a gut problem, they might not be super transparent with exactly what their proprietary blends have, each
Right.
individual dosage for each, microbiotic.
Yes, and I have a great example for this. So I have done some work in the realm of pancreatic insufficiency, and when I walk through drugstores and I see pancreatic enzymes on store shelves, there's they're not effective. Those enzymes are not really doing much. I'm not talking about lactase for patients who are lactose intolerant, but true pancreatic enzymes, they're so underdosed that even for patients who have true pancreatic insufficiency, which by the way is a very rare condition and it needs to be tested for in a very sophisticated manner, those enzymes will not treat the disease at hand. So taking enzymes like that for digestive problems, I feel is a huge it's people are being taken for a ride in those situations. I feel that if patients have true GI problems, they should seek expert care and not self-medicate with things that seem to make sense, but truly on no level uh, are they effective.
With the gut microbiome, I see there's so many nuances to it. When someone does come to the door, how do you know, and they just say, I have these symptoms, I have bloating, blood in the bowel. What is the step by step we take to properly diagnose them? Because as you said, not having enough pancreatic digestive enzymes, that's a rarity. So being
Yes.
able to funnel the options of possible diagnoses all the way to that one, what does that process look like?
Yeah. Yeah, so it involves a series of tests. I think it would be, just to backtrack a little bit, I think it's really nice to come and see an expert. We have spent countless hours, studying these algorithms, looking at the data, and designing algorithms for patients just like this, so that every test that we do has a purpose. We're excluding something. So let's take one condition, for example, someone who comes in with symptoms of irritable bowel syndrome with the diarrhea variant, and they're presenting to me. So what does that look like? Well, I will be doing some stool testing to make sure that they don't have a chronic infection. I'll be doing some blood tests to make sure that they don't have celiac disease. If they're having any symptoms that are concerning to me, like you mentioned, blood in the stools, that always raises off alarm bells in any GI's approach. And so that would warrant actual procedures to go inside and see, well, why are they having blood in the stools? Sometimes I need to do imaging of the small bowel, which I can't easily access with my scopes. But if after that exhaustive workup I am not finding a solution, then I would maybe make a diagnosis of irritable bowel syndrome, diarrhea, variant and focus my management on symptom management. And it doesn't end there. Even in terms of symptom management, there I could make a case for giving patients probiotics. I could test them for bacterial overgrowth, so put them, do further testing. But everything is being done in a methodical way. It can sometimes be frustrating for patients. We're so used to getting these quick fixes and quick answers. And sometimes, we need to rule out the scary stuff and then proceed in a algorithmic manner so that we know that, okay, we've tried this therapy, this didn't work, because patients are also, they respond to different things differently. I may have a patient who responds wonderfully to a dietary intervention. You mentioned the low FODMAP diet, while I may have a different patient who would simply just want antidiarrheals because they don't want to be on the road during carpool, with a need to rush to the bathroom. So don't discount what your GI or your provider can offer. It's important to be in tune with your body, but the reason we go through a gamut of tests is because we're trying to rule out certain things and just direct our management.
Makes perfect sense.
I hope that answered your
Yes,
question. GI is such a broad field that I'm falling into these different, disease entities, which, where we're putting together, but I'm trying my best to clarify.
it was super clear. And one thing that it did remind me of is I feel like one big problem, and it's not a problem, it's more of an exploratory discussion. It's of like how there's so many different gut types, right? There's so many different types of like I believe maybe one factor is how many bacterial species are even in the gut microbiome. Like I saw this one thing about how the Western diet well, sorry, the sub-Saharan African diet, like they
Yes,
have probably like eight, maybe like 600 to 800 species of
that's
bacterial
right.
strains in their gut microbiome. But in the Western area, it's amazing if we even have 200. So
That's right. That's right. That's right. And there's a whole like area of fecal transplant that's emerging, where sub-Saharan Africa may have the best poop on the planet.
right, yeah, and so it's yeah. And is that something that you have also like personally worked with for some patients, like fecal transplantation?
Yes. So I am not currently, but I am involved in the group of individuals who does fecal transplant at MD
Hmm.
Anderson, and I have definitely done it as a trainee. The applicability, or when we do fecal transplant, it is expanding based on what our research is showing. Currently it's being used for patients who have something called an infection with a bacteria called C. diff. That's where it's shown great results, and that's where we're doing it primarily as a specialty. Based on the direction that we're headed in, there's definitely chatter about whether fecal transplant is a good way to reconstitute the gut microbiome, and especially if we can do it from patients who have eaten such diverse diets for long periods of time, and that's reflected in their gut microbiome profile that you're mentioning. And now fecal transplant, traditionally it used to be done through a colonoscopy. Now it can also be just done through a pill. So this is also an emerging area to see all the different places where this could be useful, but more to come.
More to come. Super excited for that. And so when we talk about, again, this might backtrack the conversation a bit. When we talk about the gut microbiome, somehow we are it is hidden behind the between the lines, but we are also mentioning the immune system. I always being not super I did take biology in high school, but I always thought the immune system was just like this area in our body. I didn't realize it's actually a network within our
Yes.
body. Um, what is the how does the immune system map on the gut microbiome, and what does that role look like?
So the immune system, which is the immune cells, they reside inside the layers of the GI lining. And so in a healthy gut, um, the microbiome is not in direct contact with the immune system. It's when the microbiome is dysfunctional and those tight junctions are malfunctioning, which is when the immune system is seeing a variety of toxins and gets dysregulated. Um, but just going back to my earlier example of the patient with Crohn's disease who had an immune dysfunction which may have originated in his colon but was now widespread with manifestations in his skin because there is crosstalk, there is immune memory, right? Our whole immune system is connected.
Yes, yes. And earlier we were talking about how antibiotics, you mentioned it just a bit, about how
Yeah.
taking them is kind of is not very great for the gut
Yes.
microbiome. So I was trying to ask like a patient to patient case, like how does it what happens within like a diagnosis where you have to resort to something like antibiotics? And also like I wanted to talk about steroids as well right after that.
So antibiotics are great. The overuse of antibiotics can be damaging to the gut microbiome because it leads to, um, the gut microbiome, the good bacteria being less present after an antibiotic exposure in the GI tract. And so, personally, I have seen patients who post antibiotics, things that they were previously tolerating really well in their diet, be it lactose or gluten, for that period of time post antibiotic exposure, they're unable to tolerate it, which goes back to my point about the microbiome being so closely connected to uh, the gut integrity. And so the take home message would be that antibiotic overuse um, should not be encouraged because now that we are armed with this knowledge that there are 32 trillion bacteria and fungi in our colon which are essential for the integrity of our GI tract, which if disrupted will lead to a whole myriad of diseases, then it's important to make sure that that microbiome is healthy and thriving and it's only exposed to antibiotics if there's truly a need.
For like medications like steroids, when do those come into play?
So in my world, we give steroids to treat inflammatory bowel disease. We give oral
Right.
steroids for that reason because the dysfunction is also a chronic inflammation that's occurring at the epithelial level, and so that's when I give steroids to treat certain GI conditions like inflammatory bowel disease.
Right. So if we could just put a small magnifying glass on that, what is the steroid doing when it enters the body, specifically the gut microbiome, that's causing an alleviating effect?
So absolutely. So inflammation is an injury that occurs at a cellular level where you have cells that are recruited to that site, which are not supposed to be there when there isn't an injury. There are something called cytokines, which are recruiting these cells. And it's essentially, if you said put a magnifying glass, it's a very busy site where there's a lot of injury and repair that's occurring. And so, what taking steroids does is that it blocks our own body's capacity to repair. But by doing that, it's dampening down the inflammation, which helps with the healing.
Yeah,
Yeah, you're you're
that's
you're
super
taking me
clear.
back.
And
Yeah,
yeah,
so
I thank you so
yeah,
much.
no, I just want to say, you're taking me back
Taking you back
to
to med
med school.
school?
But yeah, yeah,
Right.
which is good for me too, I think.
Because I think I'm like a few years before med school, so I had to bring you a little back so we could have a somehow, a somehow good conversation.
Yeah, no,
Because
absolutely.
I
Absolutely. I think that's what's so neat about social media that, you meet people at different stages of training. I know that I've definitely enjoyed that. And it keeps me, I enjoy these questions. Yeah.
absolutely, and I wanted to share, Dr. Khan. It's interesting because I actually personally myself, my bachelor's was in applied mathematics, so not I haven't done too much studies in in biology and just like the gut microbiome. But what piqued my interest over the past few months was a diagnosis of my close friend. His name is Ankit, and he got ulcerative colitis, which was it was a big it was a bit devastating for us because we kind of realized how the medication he had to take, there were consequent
Yeah.
effects, like there is that weight gain, and then of course there's a mental aspect as well, which is why I sought out to immerse myself in the gut health, because what I study after studying more and more, I realized gut digestive issues, and it's to your point as well, maybe it's the ultra processed food and the stress that we are seeing nowadays, but it's like 10% of our population. Like a lot of people are dealing with this, and that really stresses the point that though genetics may be a factor, there is certainly environmental factors that are playing a big role here. So that's kind of our goal here at BioBelly, just to hopefully educate some people, because I feel like some people with these issues, they might not be well informed, and that might delay their recovery, because they don't know the right steps to take to go to recovery. They might do more of the, as you said, the band-aid
Yeah.
solutions versus the true deep healing.
Absolutely, absolutely. And my best regards to your friend. But we are in an exciting era in inflammatory bowel disease. There are a lot of new therapies, and I have no doubt in my mind that he's going to do really well. And if he has good friends like you who keep the stress levels down, that definitely helps because of everything we talked about the gut and the brain being so intimately connected.
Awesome. And just one final question. It is a bit about naturopathy. Of course, there's a role of conventional medicine. That's the main role in just identifying diseases, healing diseases. But I feel like there's this small rise of this idea of naturopathic doctors, and I feel like some people say that the naturopathic doctors, their whole why is to again address those long-term issues. So looking at a person's body, seeing if there's a leaky gut, if the body is not producing enough stomach acid to be able to digest food, or if there's a dysbiosis within the gut microbiome. I just wanted to hear your talks, your thoughts on but like what the role of naturopathy is in healing these diseases, and as well like how if maybe conventional science does rely on naturopathic um, teachings sometimes to heal their patients.
Oh, absolutely. I mean, there's definitely a role. Um, I think education would be important to know when you actually need diagnostic testing because we have to simultaneously keep in our mind that GI cancers are on the rise too. So to disregard or to write off symptoms as being unimportant may also be not the wisest thing to do in the current landscape. Colon cancer is on the rise in young individuals. So if, to write off bleeding and attribute it to hemorrhoids, for example, would not be wise in this landscape, just knowing that these things are on the rise. But of course, if you've been through a diagnostic workup and you want to rely on natural remedies, provided that they are safe, um, that it's in the right context. I see patients with liver disease, and many of these natural supplements, they are metabolized in the liver. So if there's a patient who has underlying liver disease and they're unable to metabolize some of, you know, these natural remedies, it could be a worse situation than it was starting off. So in the right context, absolutely. Um, but context matters.
Context matters. I think that's a perfect way to wrap up this
Yeah.
discussion. Dr. Khan, thank you so much for your time. This conversation was not only enlightening, but also a reminder to me that at the end of the day, the experts matter. And whenever there are issues, um, getting proper doctor medical attention is is the first course of action. because
Yes.
there's so many nuances to it, and
Yeah.
without proper testing and proper scanning, we never know what symptoms are leading to which disease, which problem.
Yeah, that's a great summary.
Thank you. Dr. Khan, thank you so much for your time. And by any chance, if you have any, I usually do this, if you have any parting words just for someone who might be dealing with a gut digestive disease, just anything that you feel sometimes may be overlooked, just to wrap up our discussion.
Absolutely. No, Trishi, thank you for having me. Thank you for all your questions and your enthusiasm. I really enjoyed this, and best of luck to you as well on launching this new platform where there is definitely a need for it. I think my parting words would be know your body. No, try to not write off symptoms that feel different to you. It's important to get educated. We are in an era where there is information overload, and it's great to be well informed, but it's also important to seek out care when you feel that something may not make sense because as this talk has shown, there are a lot of nuances to a particular symptom set. I personally am very passionate about colon cancer screening, early detection. So if there is someone in your circle of influence, whether that's a parent or a relative who is in that age group when they need to be screened for colon cancer and they haven't been, please encourage them to get scanned, to get not scanned, to get screened, whether that is through stool-based testing or seeing a gastroenterologist, because it can make a difference. Colon cancer is very common and it's very treatable if caught early. So yeah, those are my parting words.
All right. Well, thank you so much, Dr. Khan. It was a
Thank you.
pleasure.
Likewise. Thank you so much, Trishi. You take care. Thank you.
Thank you.